Good afternoon, I'm Beth Wagner. Welcome to my channel focused on movement and function. If you've recently had knee replacement surgery and you still have pain, limited motion, difficulty walking, or doing your everyday activities, you've come to the right place. In today's video, I'll start with my 8 favorite exercises for range of motion and strength, and I'll show you progressions with each of those exercises. Then I'll move on to show you specific movements that will help you kneel in order to do things like cleaning and gardening. I'll touch on walking and balance and include a couple basic recommendations for your overall long-term recovery from your surgery. Before we launch into the exercises, I want to talk briefly about the importance of breathing. Oftentimes when we're in pain, we tend to hold our breath. It's a natural reaction. However, it's the opposite of what we need to do. Breathing helps to decrease pain by calming our nervous system and improving our blood flow. Improved blood flow helps to reduce tension and release tightness. So as you go through these exercises, monitor your breathing. Make sure that you're breathing in and out with each movement. I recommend before you start the exercise, take a nice deep breath. Then as you begin the movement, exhale and inhale as you return to the starting position. Restoring your range of motion is our first priority. We want to have enough knee extension or straightening of the knee so that it's almost even with the other knee. We want to have enough flexion or bend in the knee to be able to stand up from a low chair, get in and out of the car, and get on and off of the floor. Exercise number 1 is a quadriceps set. You'll want to tighten the muscle on the top of your thigh and push your knee down into the surface. You might notice your ankle coming off of the surface as well, and that's just fine. Hold for 5 seconds and then release. To progress this exercise, you can take an ankle weight or a bag of rice or beans, place it on top of your thigh. Make sure you don't put it right on top of your knee. You want this on the muscle, not on the joint. And press down and lift. Another way to progress this exercise is to put your ankle on a pillow. With your ankle on the pillow, the knee will be hanging. That will emphasize the extension stretch as well. Exercise number 2 is a combined movement of a heel slide with knee to chest. I'll start by sliding my heel up towards my hip, lift my leg, and bring my knee in towards my chest. A progression here is to gently press in on your shin to emphasize the knee bend. Then return back to the starting position. You could also progress that exercise by using an ankle weight. I'll bend my leg, bring it up towards my chest, and gently press. And return to the starting position. Exercise number 3 is a combined knee flexion and extension exercise. I'll be straightening my leg and then bending my leg. Straightening and bending. The best place for you to do this at home is probably a dining room chair, possibly the edge of your bed, as long as you can bend your leg back far enough to get a really good stretch. A good progression with this exercise is also using the ankle weight. Now let's move on to the strengthening exercises. Exercise number 4 is sit to stand. The purpose of this exercise is to reduce how much you're using your hands to push off and to make sure that your weight is evenly distributed between your left and right leg. Step number 1 is to scoot to the edge of the seat. From there, lean forward and stand up. When I sit back down, again lean forward and sit back down. You can place your hands wherever they're comfortable, on your thighs, reaching forward, or on your hips. To progress the sit to stand exercise, try holding onto a couple of dumbbells or soup cans. Exercise number 6 is a heel toe raise. Stand next to a countertop or some surface for support. We'll rock forward onto the toes and lift the heels. Then we'll rock back onto the heels and lift the toes. I'll show you from the side. Push up onto the toes, rock back onto the heels. This is an excellent exercise to help strengthen the front and the back of the lower leg. To progress this exercise, try adding an ankle weight to the lower leg. Exercise number 6 is a side leg lift. Shift your weight onto the left leg, lift your right leg up to the side. Bring it back down. Lift up and bring it back down. Let me take a step back and briefly talk about breathing with this exercise. This is a good example of something to try with your breathing. Before I start the exercise, I want to inhale, and then as I lift my leg, exhale. As I bring my leg in, inhale. As I lift my leg out, exhale. If that doesn't feel natural for you, don't force it. The point of this is to simply pattern your breathing with your movement. See what feels good for you and make sure you're consistently, naturally breathing with a good rhythm. Exercise number 7 is a back leg lift. I'll shift my weight again and lift my leg back behind me. With exercises number 6 and 7, make sure you're maintaining good upright posture. So when you lift your leg out to the side, you don't want to be tipping over. And when you lift your leg back, you don't want to be arching your back or tipping forward. Just make sure from your waist up, you're maintaining even posture. The last exercise is standing on one leg. This introduces a little bit of balance to your program. Shift your weight, lift one leg, and hold for as long as you can. And then lower the leg. As you feel more and more comfortable, start to tap on the surface. Gradually increase the amount of time that your hand is off of the surface until you're able to do this exercise comfortably without your hands near the surface. A great way to progress the side and back leg lift is using the ankle weight around your lower leg. Let's move on to the kneeling progression. First of all, before you do these exercises, check with your surgeon. If your surgeon told you that you are not supposed to kneel on the operative knee, then please don't do this exercise. There's a reason for that. Most of the time, though, surgeons don't say anything about it. And in that case, feel free to try this out. Let comfort be your guide. This exercise should not be outright painful. It might be a little bit uncomfortable because you likely haven't been kneeling in a while. But that discomfort should improve with time, and you shouldn't experience any swelling, redness, or joint pain. Step number 1 is to find a soft, squishy, comfortable chair. With your hands on the back of the chair, gently place your knee on the seat and press in as far as is comfortable for you. As you feel more and more comfortable, press a little bit farther, keep your knee on the surface a little bit longer. Step number 2 is to start to move closer and closer to the floor to allow you to do things like clean the floor and reach under your bed, maybe do a little bit of gardening. Placing a pillow on the floor, using some type of support surface and the seat of the chair, we're going to place your knee right on that cushion. Another progression is to add the other knee. From this position, you can experiment with reaching or moving around on the floor as you feel comfortable. As you gain confidence and strength kneeling onto the floor, gradually decrease how much you're leaning or resting on a support surface. For improving your walking and your balance, I strongly suggest you check out my other videos focused on those topics. For the purpose of this video, I will say the most important thing with your walking is to get rid of the limp. The exercises I've already demonstrated will help you with that immensely. The last part of it is to watch yourself walk in a mirror and simply see how even or uneven you are and play with that. Recovering from total knee surgery can take up to a year or even longer for some people. This requires a great deal of patience and perseverance. Losing some range of motion is very common, so you'll want to continue doing these exercises 1 to 2 times a day for as long as you need to do them in order to maintain your new range of motion. Try to think of these exercises as basic daily activity, just as important as brushing your teeth, washing your face, or any number of the things that you do on an everyday basis to maintain your overall health and function. Time to wrap up this video. Keep up the good work of attending to your knee and keep it moving. I hope you found the information in this video helpful for restoring your range of motion, your strength, your movement, and your function, so that ultimately you can get back to doing the things that you love to do. Here's to your healing, health, and happiness. Please consider subscribing if you haven't already done so, and if you'd like to be notified when I release my next video, click the bell. Also, if you have friends or family that have had knee surgery and you think they might benefit from this video, please send them the link.